Welcome to the WRAL Daily Download. I'm Luis Fernandez. More than 2.5 million North Carolinians will have more than $6.5 billion in medical debt relieved. It's a program set up by the state and paid for with federal funds. WRAL state government reporter Will Doran joins us now with more on the announcement that Governor Josh Stein is calling, quote, life-changing news. Hey, Will, how's it going?
It's good, Luis. Thanks for having me on.
Yeah, happy to have you here. This is really a big deal, right? I mean, this was announced on Monday morning. Take us through just the basics of what this is, how this works.
So this is really actually a first of its kind program in the entire country. And, we heard from some people who are in the healthcare industry or involved in, charities that focus on medical debt today. And they said, we need other states getting on board with what North Carolina is doing. This is, such a creative way to tackle this program, and they view it as kind of a win-win, for patients and for hospitals, and for the broader state economy as well by getting rid of people's debt and kind of letting them move on with their lives. And it's just it's a creative use of federal funds that we get through Medicaid. I checked. It is not affected by the government shutdown. It's separate from all of that. So, even though, yes, the federal government is shut down right now, these, federal Medicaid dollars are still flowing through and are still going to, be impacting people really soon here in the coming days.
How soon? Is there a general understanding of when this policy takes effect?
Yes. Well, the policy is in effect now, and letters are going to be hitting the mail immediately to these 2.5 million North Carolinians, informing them that, hey, your debt no longer exists. And for the people who are affected, it's an average of over $2,500 a person.
Wow.
So, definitely big money coming, for people who've had this debt, some of them for years. And so those letters that people will be getting will be from either the hospital that you owe the debt to or from a charity undue medical debt. So if you see that piece of mail, don't throw it away. That is definitely some good news that you're going to want to keep an eye out for in your mailbox if you might be one of these 2.5 million low to middle income North Carolinians who are affected by this.
So looking at your article, which you can find on WRAL.com, all 99 hospitals in the state are committed to this. This feels like a really big undertaking. When did this start? How did this all come together?
So this actually began last year under former Governor Roy Cooper. It was, Josh Stein who gets the credit and the announcement today of making it. But it started under Cooper and his former head of Health and Human Services, Cody Kinsley, who I also saw today. He was at the governor's mansion for this announcement. And they came up basically with this way to, as I mentioned, use these federal dollars in kind of a unique way that no state has tried before, but that the Fed said, yeah, you can do this. To go back and find people who had debt. And so the hospitals looked in their systems and said, okay, yeah, this person qualifies. And it's, for people who are on Medicaid. And so this is not just a one-time thing. This is going to, kind of continue rolling into the future. And so, if people come through and they do qualify for this program, then, and they're unable to pay, then they could have their debts forgiven. And, of course, this is not 100% of medical debt in North Carolina being forgiven. That's not what's happening here. It's really focused on low-income families and, some kind of middle to low-income folks as well. But, yeah, it's a program that other states are now going to be looking to us for our leadership on and, something that is, potentially going to be getting some national attention here.
I don't know if you would know the answer to this, but why is North Carolina the first to execute something like this? Is it just a matter of approaching laws and policies in a creative way? How does that come together?
Yeah, I think it's just a matter of, who you've got in charge and, who's going to be, taking a phone call. One of the folks on the charitable side involved in this and, just efforts to get people's medical debt relieved. He's the vice chairman of the board of the charity and happens to live in North Carolina and, had, talked to some folks here and he spoke today with the governor as well. So, sometimes it's just about that, that personal human connection and also just having the people in place who are, willing to kind of, swing for the fences on something that nobody else has done before, but has turned out to be good news for a quarter of the state's population. About 1 in every 4 people is going to be affected by this.
Wow, that really puts it into perspective. Let's go ahead and take a quick break there. When we come back, we dig more into that individual human perspective, how this is going to impact those who will have their debts forgiven. Welcome back. We are talking about a program in North Carolina that will forgive $6.5 billion in medical debt for more than 2.5 million North Carolinians. WRAL State Government reporter Will Doran is here with us. Will, this was announced on Monday. You were at that announcement. How would you just describe the atmosphere of this being kind of revealed to folks that, hey, this is a policy that we are enacting now. You're going to be getting these letters shortly. Almost like a congratulations, I guess.
Yeah, congratulations. You don't owe this money anymore. It's been forgiven. And that was really a big focus of this that we heard not just from Governor Stein, but from plenty of other people who spoke, both within his administration and also just the private healthcare sector. They said, look, medical debt is not something you choose to take on. Like when you take out a mortgage for a house or a loan to go buy a new jet ski, you're choosing to do that. You know what you're getting into. So, if you get debt from that, you need to deal with that. But no one chooses to have a heart attack. No one chooses to be in a car crash and need surgery. And also, when you go to the hospital, you can't shop around and see, okay, well, I'm going to pick the most affordable or most sensible services, because hospitals won't tell you how much stuff costs. So not only do you not have the ability to choose when you're going to take on the spending, you also have no idea how much it's going to cost you when you're getting into it. And, you can look county by county. In North Carolina, large percentages of the population have medical debt, particularly in rural areas, but it's every county that's affected by this. And it's a life-changing thing for a lot of people. I mentioned it's over $2,500 per person who's being affected by this forgiveness.
Now, for those that may be fortunate enough not to have a huge amount of medical debt, can you talk a little bit about just what this does, how this helps people who, like you said, are lower income, that are having this burden removed from their shoulders?
Yeah, well, one, it helps the hospitals, because the people being affected here are largely people who don't have a ton of income available to them, and we're probably never going to be able to pay this debt off anyway. So that's why every single one of the state's 99 hospitals participated in this, because they're interested in helping their own bottom line. So hopefully the idea is that could keep costs down for the rest of us, if we're not having to subsidize other, outstanding debts that hospitals have. The other idea for the individuals is, if you have a lot of medical debt outstanding, that hurts your credit report. And that makes it harder to get a job. That makes it harder to get an apartment. That makes it hard to take out a loan. And all of these things are things that drive our economy. So if you help people get a job more easily, get an apartment more easily, take out a loan to start a business more easily, then that, the theory is that's good for the broader economy. So even though it is obviously good news for these individuals, even people who aren't directly affected by it could benefit still just by the economy growing. The other thing, though, is just almost the psychological aspect of it. We heard from some doctors today who said, oh yeah, countless times I've had patients who have told me, even cancer patients, well, I'm afraid that, this treatment is going to put me and my family into debt, so I'm just going to choose not to do it. And in some cases, that means choosing to die to avoid this debt. And so they said this is just, a scourge that we have and we need to take care of. And this is at least the first step in taking care of this. And they said for other people, it can also lead to them choosing not to get further treatment. You go into debt for one treatment, and then months or years later, you have another medical issue that comes up. And, again, doctors we heard from at this announcement said, oh, yeah, those people, are scared that if they go to the hospital, they're going to be arrested or forced to repay their other debt before they can get their new treatment, which isn't necessarily true, but a lot of people think that it is true. And so the hope is that, not only do you help the hospitals kind of bring costs down a little bit, that you help the broader economy, and that you also just help people's health.
I want to circle back to this too, because at the beginning you mentioned this is not just a one-time, congratulations, your debt is forgiven. This is going to be an ongoing process, correct?
Yes, and that was intentional in the way they set it up, that it would not just be this one $6.5 billion check that gets written, that this is going to be a periodic thing where they review it, working with the hospitals to see who qualifies for forgiveness and who needs the forgiveness in order to keep this rolling. So at least for now, as long as the feds are paying the bills, it's going to keep on happening.
That's WRAL state government reporter Will Doran. Will, thank you so much.
Thank you.
I'm Luis Fernandez. Thanks for joining us, and thanks for listening to the WRAL Daily Download, and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.